Now, many, many years ago, we did a surgery on your spine, and initially that did help you, correct?
Correct.
No, and then you were okay for how many years?
It was roughly about 8 years ago.
8 years ago. So you were okay until just about, what, a year or so ago?
Yes, November 20th of 2019, I got hurt.
Okay, and then you have problem in your spine and pain going down. How bad is that pain?
The pain is roughly about a 9
9.
right now.
Yeah.
Yep.
Now, I'm going to just come to to what we want to discuss today, which is the discogram. But you got an MRI, and MRI sometimes doesn't really show what the problem is. So when we looked at the MRI, the height of the disc is all right, and so on. And somebody who is less involved in the management of the spine would have said, MRI look normal, just go away. It's nothing there. It's all in your head.
Right.
And I think you have been told that, right?
Yeah, I've had that happen, and I didn't believe it. And
Yeah,
I'm like,
well,
I need to see Dr. Abbasi.
Yeah, but no, they practically told you whatever it is nothing. You just go live with it.
Right.
Whereas we did a discogram,
Yes.
right? Describe to me. Discogram is a painful study, but I'm going to show why is it worth it to do it.
It's a very painful procedure, but it's very much worth it because it has proven that
What the problem is.
I have an issue, and
Yeah.
it was not in my head,
Exactly.
and I do need to have a
Yeah.
surgery
Yeah.
to correct it.
Yeah. Now I'm going to turn around and show the discogram where we literally go inside of the individual disc and provoke it.
Yeah.
I tell my patient a disc is like a tire of a car, and like putting air in a flat tire. You see where it's leaking out because we
Yeah.
put a contrast that we can follow. And it is painful because we are trying to provoke the disc that we think is a bad disc to see how it's behaving. Like poking your finger in a wound to
Right.
see if it truly what's painful is or not. And provoking as well, many times when you get an MRI, you're laying down on your back, putting no pressure on that.
Right.
Even a flat tire will look normal if you take the pressure off.
Right.
And that is sometimes what misleads people who are not versed in spine management. They just look at the MRI and that's done for them. Now,
Right.
I'm going to show you here. This is the discogram. First, I'm going to show a normal disc. We did a normal control level. And the normal disc, you see, we put the contrast in, everything stays in. This is the needle, part of the needle that we put the contrast in your spine, in your disc.
Right.
So we went from the left side. Now, I'm coming to look at the 4-5 here. Look at that. We put the needle in, we put the contrast in, and the contrast doesn't even stain. It's a huge gash, bulge, tear in the disc, and everything goes there. And guess what? Here are the spinal cord and the nerves of the spine. And here is exactly where the nerve is going out. And you have symptoms of that. You have exactly symptoms of that correspond to that nerve being pushed. So I can tell you it's not in your head. So you had a previous surgery 8 years ago. And the question as well is, that is nothing unusual. That people who have a surgery in one level, up to 35% of them have problem in the other levels.
Right.
Now, some people say don't get spine surgery because if you get that, other level will go bad. And but we don't do spine surgery for just trivial things.
Right.
We do it when you cannot live with that. And on top of that, I think, and many of my colleagues think that the reason you get a bad disc higher up is not because we fixed the first one. It's because the same process that works on the first one as well work itself on other discs and make them go bad. So your situation is nothing unusual. You had a bad disc, we fixed that. Few years later, the next disc is in a bad shape, and even though on the MRI it doesn't look super bad, sometimes MRI is not enough.
Right.
And so we have proven, here it is not in your head. Here the contrast is completely leaking out, and the best way to look at that is comparing this to a normal disc right there.
Right.
And that sort of says all we need to say.
Exactly.
Well, I'm happy that we found the problem and we can fix it now.
I'm very happy
Yeah.
with getting it fixed.
Excellent. Thank you so much for the interview.
Thank